Good day, ladies and gentlemen. Welcome to SOS, Sharing Our Science, a brand new series of podcasts brought to you by the South African Medical Research Council, where we aim to share our research and find out just how we use science to save lives and improve the health of the people of South Africa. My name is Dr. Ibrahim Simodin, working in the Office of the Vice President and Cochrane South Africa, responsible for research translation and knowledge dissemination. Today, I have with me the SAMRC Vice President of Extramural Research and Internal Portfolio, Prof. Liesl Zühlke. She's also the founder and director of the Children's Heart Disease Research Unit at the University of Cape Town. Prof, welcome to SOS.
Thank you. Good to be here.
So, in South Africa, February is Healthy Lifestyle Awareness Month. What is the purpose behind this awareness campaign?
So, our Lifestyle Awareness Month focuses on just 3 simple things. It's balanced nutrition, regular physical activity, and mental well-being. And the point of focusing on those 3 is to prevent chronic non-communicable diseases. So it makes small little changes in those 3 areas to make sure that we improve our long-term health.
Thank you very much, Prof. Can you tell us about some of your research and how this fits into making healthier lifestyle choices?
Yes, so my research focuses on childhood onset heart disease. And it reminds us that most of the heart diseases that you're aware of in adulthood, such as hypertension, diabetes, or ischemic heart disease, all starts in childhood. So I really emphasize nutrition, as I've mentioned, right from the early days, making sure that children incorporate activity into their daily routines from early on, and then, of course, mental well-being, which is so important for childhood. And my research ensures that if we do all of these in childhood, we will have healthier hearts and therefore healthier lives when we're in adulthood. The other important part is prevention. And one of the most important parts of prevention is knowing your numbers. So I work in making early diagnosis of heart disease, checking blood pressures when you're very early, checking your blood sugar, and making sure that you know any of the numbers that put you at risk for problems later on. Thanks.
Thank you so much, Prof. Before we go, are there any key messages that you can share with the public in terms of how they can live healthier? And maybe tell us a few things that you will do yourself to be healthier.
Thank you. Yes. Well, let's start with nutrition. We talk about eating more whole foods. So not processed meat, but rather meat that looks like a piece of chicken, vegetables, fruits, and reducing sugar and salt. So one of the things that I do is I no longer ever have sugar in my tea or my coffee, and I try not to include salt until I've at least tasted the food. Some of us put the salt in before we even taste. Then activity, so important to do at least 30 minutes of good activity every day. I love to hike and to run, and then spending time outdoors is also good, of course, for my mental well-being, which is the other thing. So we encourage people to focus on their mental well-being. One of the most important is getting enough sleep and never starting smoking, which I've never done. And then prevention, I do check my blood pressure, my sugar at regular intervals, often getting them checked at the SAMRC. So those are a few things that you can do to really improve your long-term health.
Thank you so much, Prof, and thank you for your time. We really appreciate it. That's it on this episode of SOS and Sharing Our Science. Let us know your thoughts and also what you plan to do to be healthier. Sharing is caring. Who knows, we may inspire out there to be healthier. For more information about our research at the SAMRC, visit our website at www.samrc.ac.za. Till next time, take care and be well.